Okay, Assalamualaikum warahmatullahi wabarakatuh and good afternoon to all. Today we continue our weekly journal club. With a presentation from Mr. Muhammad Hafizi bin Mahmud from Faculty of Health Science, UiTM. Just want to ask, are you ready, Mr. Hafizi?
Yeah, sure.
With the title Urinary Stone Composition, how does dual energy CT tell you? Without further ado, I would like to invite Mr. Muhammad Hafizi to present.
Can you see the slide? Is it appear in the screen?
Yes.
Okay.
Good to see you, Hafizi.
Yeah, okay, right. Okay, right. Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and very good afternoon to the Mr. Chairperson. Also, thanks to IMMB for inviting me to share for this Journal Club webinar. Okay, and also to all the participants who joined for our this afternoon webinar. Okay, I can see some of the participant from the medical imaging background. I can see Dr. Masyarah here, and also from my students.
Hi, how are you?
Hi, okay, hi.
Good.
I try to make it this sharing session to be more simple, because it's try to not make it is too technical, because it's a CT, because CT is quite is technical. They have a technical terms. Okay, I'll try to my best to make it is simple and easy for all the participants, especially for those from non-medical imaging background to understand our discussion topic today. Okay, so I'm Muhammad Hafizi Mahmud, lecturer from the Center for Medical Imaging Studies, Faculty of Health Sciences, UiTM Puncak Alam. So I'll be presenting for today's session, kidney stone composition. What does dual energy CT tell you? A little bit make a modification on the title. I mean, we'll be focusing more on kidney rather than urinary tract. Okay, so okay. Before that, so my presentation will cover the background and the principle of dual energy CT, and also some background of kidney stone and how dual energy CT is applied to uh, to image or to characterize the kidney stones. Okay, so basically the principle of dual energy CT. Basically, we have routinely used in the clinical, we have a single source CT. Okay, single source CT. Um, okay, single source, which means we have one X-ray tube. Okay, one X-ray tube and also detector that we call as a single source. Okay, and then so what mean by dual energy CT? Okay, dual energy CT meaning that they have can have a two two X-ray source, two tube. Okay, this one and the first tube and also tube with two different energy. Okay, so that's the basic idea what is a dual energy CT. Okay, so CT used to X-ray photon spectrum to create images and allow differentiation and classification of tissue composition. This is the main application of dual energy CT, to differentiate and classify and to characterize the tissue composition. Okay, also known as a spectral CT. Yes, spectral CT, and generation of two spectrum CT varies among CT vendors. Different vendor they have different specification of the dual energy CT. I will share that later on. Okay. This the That's the principle of CT, how the S-ray is generated. Okay, so actually it's based on S-ray attenuation. Okay, S-ray attenuation, which is the two major interact. One the radiation or the S-ray interact with the matter. For example, for the interact with the soft tissue or the bone and other matters, we will undergo two main process. Which is the first one is photoelectric effect. Photoelectric effect meaning that the radiation will be absorbed in the tissue. Okay, will be absorbed in the tissue. Okay, and uh, and also for the Compton effect, meaning that the radiation will be scattered. Okay, will be scattered from tissue. It's not absorbed, but later then it will be scattered by the tissue. This is the two main interaction of radiation with tissue. This is the principle of dual energy CT. Okay, this based on the linear attenuation coefficient. Okay, based from this graph, you can see this is the linear attenuation, and also this is the energy. Okay, for example, we have a bone. For example, bone with high attenuation, high density, the iodine. We assume iodine, and also another type of iodine, which is with lower density. We have three material here, three different material here. Okay, if you look at this one, the same linear attenuation can be attained from different material. If we have basically the material, they will have different attenuation. So this attenuation actually based on the tissue atomic number and also the tissue density. Okay, for example, in this based on this graph, we have the iodine and bone. Even though they have different density and attenuation, but based on the linear attenuation coefficient graph here, okay, they will have the same but this one at the same at the same point. Okay, so that they may have the different what we call it the attenuation here. Okay, based on the single energy. If you have if we use the single source CT here, so they can be overlap. They can be overlap here. Okay, but when we measure the attenuation when we give we apply the second energy, is allow the two material to be differentiated this here, this here. Okay, when we apply the second energy, okay, for example, this one is a 50 keV, so this one is 100 keV. So by applying the second energy, what we call as a dual energy, we can separate the attenuation of these two material. Okay, you can see here the graph, they are separated. Okay, so this is the basic concept of how the dual energy CT works. Okay, so which is this differentiation of the attenuation. Okay? It can be useful to improve the material identification and characterization. Okay. And another is the some principle of the energy city. We have, for example, we have the large attenuation difference here. The more steeper the graph is, the more you have the larger the attenuation. For example, like this one is a bone. For example, this one is like for example tissue, parenchymal tissue. For example, they have the small attenuation difference. Okay. These are some of the technical approaches of dual energy city as provided by different manufacturers, as I mentioned in the first slide just now. Okay, so under dual energy city, we have various approaches. Okay, for example, for this one, as we have the manufacturer, the some of the common manufacturers for the CT scan for the CT scanner for the CT modality. For example, we have Siemens, okay, Siemens and GE and Philips and also Toshiba. These are the most common manufacturer. Okay, for example, for the Siemens for dual energy CT, it applies two tube and two detector. Okay, they have two tube and two detector which with 80 kVp and 100 kVp respectively. Okay, two tube and two detector. Right, this one. Okay, for by GE they only apply one tube and one detector, but they use a KV switching. Meaning that during the image acquisition, the KV is switching in a very short time. Okay, they switch from the low energy to high energy. Okay, and also by Philips, so they use the dual layer detector. Okay, they have the detector, they have the single tube. Okay, but they have a dual layer detector, which is the outer part is the for the low energy, and the inner part is the for the high energy. Okay, this is applied by Philips. Also the Toshiba. Okay, also they apply the KVP switching. Okay, similar with GE. Okay, they're switching high tube voltage between high tube voltage and also low tube voltage. Okay, this how they have different approaches provided by different manufacturers. So I'll be focusing on this one on the Siemens because a bit familiar with Siemens. Okay, using the two source dual energy city. Okay, this one okay, if you look at here, for single energy, which is routinely used in the clinical, they have the mean no spectral separation because it just only use one energy. Okay, for example, for example 120 kVp for most of the procedure, CT procedure. Okay, this one for conventional dual energy CT, that refer to the first generation dual energy CT. Okay, so the first generation have a little bit spectral overlap. Okay, so spectral overlap and limit energy separation and limit dose efficiency. Okay, so in conventional dual energy CT, no filtration is used. Okay, they no use filtration. And then thirdly, on dual source dual energy CT, um, they improve. That means the system have been improved using thin filter. Okay, that I'll be focusing on this thin use application of thin filter from my study in the presentation. Okay, this one is okay dual source. So we have the dual source and the first tube. Okay, with low kV, which is at the kV, and also high kV 120, and this one is a thin filter is applied. Okay, like we apply a thin filter. Okay, these are some of the clinical application of dual energy CT. Often is for example for this one monoagnetic class and for the lesion study, and also this one for bone study and lung perfusion effect in lung imaging. Okay, so for the iodine uptake and this one for patient result and so and also with this detection of metal artifact and this composition of characterization of the kidney stone composition, which is I will be focused here. Right, let's see. Uh, okay, and also bone marrow and also hemorrhage. Actually, a lot of application. So I'll just be focusing on this how the NDCT can be used to characterize the kidney stone. Okay. All right. Okay. Yes. So we go to the on the kidney stone or the renal stone. Just an overview. Okay, these are from the newspaper. Just take from the newspaper source, Bitahara and also Metro. Okay, which is the kidney stone is quite common disease among Malaysia. Okay, which is known to be related with the family history and also gender and also the age. Okay, which is a male is reported to have a higher prevalence of kidney stones compared to female. Okay, and the aging factor, so can affect is one of these factor for the kidney stone. Okay, also the diet, the dietary habit also one of the factor for the uh, for the kidney stone. This okay, as I mentioned, kidney stone also associated with aging population and dietary habit, and this one of the study on the one of the Malaysian study from HUSM, okay, which is show that calcium is the most common component of kidney stone among Malaysian. Okay, so one just see about very high frequency, about 72.6%. Okay, so the other component like uric acid, uh, also uric acid and also ascorbate and brucite. Okay, and also and calcium phosphate and calcium oxalate. Okay, and also hydroxy apatite. Okay, this some of the component we discuss later, the component of kidney stone. Okay, which is uh, my presentation today. I will focusing on more on this on the calcium based component of the kidney stone. Okay. Then okay, so before that, actually, when we use the imaging to look to image the kidney stone, basically it will be appear as either it could be a very lucent or very opaque. Very lucent meaning that the image, the stone cannot clearly seen on the image. They are very lucent. Okay. Uh, of course, in simple word, very lucent means that it appear as a dark. Okay, on in the image appear as a dark. So we cannot. It's difficult for us to differentiate to identify the image. Okay. Uh, Otherwise, it's not also it could be appear as very opaque. Very opaque meaning that the kidney can be appear as a become brighter, okay, as a white in the image, so we can see clearly on the image. Okay. These are some of the characteristic of kidney stone. Um, these are calcium. Okay. They have the high frequency as some of the common cause hyperoxaluria. Okay, and so this is the SU of the SU value of the calcium stone. Okay, we have uric acid and cysteine. Okay, basically, kidney stone could be divided into uh, two major groups. The first one is uric acid stone, and second one is non-uric acid stone. Okay, so the calcium and cysteine, how to say, hepatite, brucite, and so on are classified as a non-uric acid. Okay. These are some of the treatment options for the kidney stone. Okay. Uh, the first one is oral dissolution therapy, or ODT, or some is called as a chemolysis. I mean, this is for more useful for those patients have uric acid. We have a uric acid stone. Okay, so the urine will be atlas, Okay, so to control the uric base of the stone. Okay, and then so we have a ureteroscopy. Okay, we insert the scopy here to the from the urethra, and then also up to the ureter. Okay, and you have the basket here to remove the stone. Okay, the uteroscopy. And then we have another option, which is extracorporeal shock with lithotripsy, or ESWL, which is under fluoroscopy, which is a real-time imaging. Okay, so they use a specific the energy to generate the shock wave, okay, the energy, and to remove the stone, to breaking down the stone into a small fragment. Okay, uh, so this ESWL is more uh, appropriate for small size stone. Okay, and then we have also percutaneous nephrolithotomy, or PCNL. Okay, so PCNL, so okay, this is more suitable for the in those if the treatment is not suitable for uteroscopy, and also PSWI. So the alternative or the option, another option of treatment is PCNL, which is for stone with a large, for the larger size of stone. Okay, we put the we insert the the catheter through the kidney. Okay, these some of routine imaging modalities to assess the kidney stone. Basically, we have plain radiography, which is known as KUB. This is the, we can say, is the baseline uh, of the assessment. Okay, KUB kidney, ureter bladder. Okay, kidney tomography, but have disadvantage of very low resolution. Okay, some of the limitation is some of the stone, they are very lucent. They appear as very lucent, which is we cannot clearly uh, detect, cannot clearly see the presence of stone in plain radiography. It is the major limitation of plain radiography of KUB. Okay, also we have the ultrasound. Okay, the ultrasound. Sometimes when the plain radiography is not clearly visualized, so the clinician would request for ultrasound. So you can, which is the advantage, of course, is non ionizing radiation. Okay, you can see uh, the stone. Okay, and also another modality is using the CT, which is the routine CT, which is non-contrast CT, so without contrast media. Okay, so this is very useful when, because the stone will appear as very opaque. And very opaque, as I mentioned just now, very opaque, which is the image will be appear as bright, so you can see as white. Got here. So this one, they have a certain have high attenuation here. Okay, if you measure the CT value, they show a high CT value here, so you can see clearly, even using the non-contrast CT procedure. Okay. All right. This and then the imaging have been improved. Okay, have been improved from the radiography, ultrasound, uh, non-contrast CT, and extended to dual energy CT. Okay, so in dual energy CT, we have a special software that we call as a Winnerstone kidney analysis software. Okay, which is a color coded image. Okay, color coded image. Yeah. Okay, we can give the based on the color coded image mapping. Okay, which is, for example, this one, the red color here show as the uric acid. Okay, and the blue one is the non-uric acid. It's clearly differentiate based on the color coded image. Okay, also like for this one, this okay, from the this paper. Okay, this from the okay, this one, the red refer to uric acid, and the blue one is refer to non-uric acid stone. So it's very helpful. Okay, just based on this color coded image. Okay, right. Next we move to, so I will show some of my finding from this study using so actually this study I'm using these are phantom study, the ex vivo phantom study. So we use uh, we have take a sample from the kidney stone, just following the PCNF procedure. Okay, and then we image, or we scan those sample under the ECT. Right. And also we extend for further analysis with FTIR analysis for the as a chemical analysis to validate the finding of dual energy CT. Okay, so so this is the result of the study. So we have the dual energy ratio. Okay, dual energy ratio means that the ratio, the specific ratio used to indicate the ratio of low energy and high energy. Okay, remember in dual energy we use two energy, which is the low energy of 80 kVp and also high energy of 120 kVp. Okay, so these two, and uh, between these two energy we have the high energy the ratio of high energy over the low energy, so we get the dual energy ratio. Okay, so in our study, we applied thin filtration, okay, thin filtration, and we found that without this one is the result without filter, and on the right side is the with filter. So we can see here for uric acid, I mean the result is not, they are almost similar, using without filter and with filter. But obviously you can see the range of dual energy ratio for non-uric acid is higher. Okay, is higher on the right. Okay, this one on the right side. Okay, with the range of 1.89, okay, as compared to 1.49 for protocol without thin filtration. Okay, and okay, then this one also that I would like to highlight here. Okay, when we apply the thin filtration, it can clearly uh, show and characterize the non-uric acid stone. Okay, so this one uh, you can see on the stone composition, we have the uric acid, calcium oxalate, calcium phosphate, cysteine, and hydroxy uh, apatite. Okay, so all this one is the calcium oxalate, calcium phosphate, cysteine, and hydroxy apatite is non-uric acid. Okay, which is show that the thin filtration is very useful to characterize and to differentiate the non-uric acid non-uric acid stone. Okay, um, you can see you have the different dual energy ratio, which is mapping uh, on this graph. Okay, we have a okay, which is the thin filter. Using the thin filter, you can have a higher dual energy ratio, okay, as compared to without thin filtration. Okay, so there is less overlap. Okay, we can see here. Okay, for uric acid, we have try to okay. Uh, okay, so, okay. For uric acid, it's almost similar, which is a little bit overlap. Okay, a little bit overlap. Okay, even without filter and with filter. But when we apply the thin filtration, this less. That means they apply the separation. Okay, that means less. I mean no overlap of the stone of the stone of no overlap among the non-uric acid stone. Okay, that is one is calcium oxalate, cysteine, and calcium phosphate. You can see clearly, okay, the distribution of the this based on dual energy ratio value. This okay, let's say we have 33 sample here, USC, and okay, and of course from this one you can see that the calcium oxalate and also the cysteine is significantly differentiated. Okay, when we apply the uh, thin thin filtration in our dual energy CT. Okay, also of course the uric acid. Okay, so this one is we validate our DCT finding with FTIR, Fourier transform infrared spectroscopy analysis, and we have the 33 sample of stone and CT validated with filter and so without filter, and we match with the FTIR analysis result. Okay, and then we get okay when okay, so our findings show all those all of our samples, they are meshed. They were meshed with FTIR. For example, FTIR CT, dual energy CT with filter. They for the first sample, they detect as calcium oxalate, and also similarly as calcium oxalate in FTIR. Okay, you can see here all they are similar. Okay, they are similar. Okay. And then we apply the Kendall-Tau correlation to correlate between the CT and also FTIR, and we find a good correlation with R value of 0.716 and the significant correlation. Okay, so this show that the dual energy with thin filtration, they have 100 sensitivity. Okay, and then without filtration, okay, here, okay, for example, without filtration, HA had to say apathetic, okay, but as a FTIR, this show as a calcium oxalate. Okay, this one also HA and HA. Okay, so the sensitivity is just about 48.5, okay, for DECT without thin filtration. Okay. So this is very important for FTIR because it's chemical analysis. Because some of the procedure, uh, the stone will be further analyzed, using FTIR after the procedure, uh, after the procedure of uh, dual energy CT. Okay, just to confirm, is it their mesh or not between CT and also FTIR. Then you have some of the CT attenuation of the stone subtype. For example, like this one, uric acid have the lowest attenuation. Okay, attenuation refer to the main the CT value. Okay, I mean the more uh, the the more the denser the substance or the material, the higher the CT attenuation. Okay, for example, as a simple example, if we have a soft tissue and we have bone. Okay, so the bone soft tissue we have low attenuation as compared to bone. Okay, so in this stone subtype, okay, you can see have at least in this range 16 calcium phosphate, and the highest is a calcium oxalate. It can be up to more than 2000 pounds per unit for He. Okay, this one I took from McCullough 2015. It is in vivo study from the patient. Okay, so this study they applied dual energy CT with thin filtration. Okay, so based on the color coded mapping. Okay, so this the image here is A is a uric acid stone, so B is a cysteine, and this one calcium oxalate, and it's an apatite stone. Okay, so you can say that the color coded map software is very useful to characterize and to differentiate the subtype of kidney stone. Okay. Okay. So then some of the important point I would like to highlight here. Okay. So using dual energy with thin filtration, we can improve the spectral separation as a result of increased dual energy ratio. Okay, and which is a no overlap of attenuation between those material. Okay, and of course it will increase the differentiation between uric acid and non-uric acid stone. Okay, and it's very helpful when we apply the thin filtration to discriminate the non-uric acid stone particularly with a small effective atomic number. Okay, medication such as calcium-based stone. For example, in from the finding yes, that I presented just now, okay, the calcium-based stone which are calcium phosphate and calcium phosphonate, they have almost similar um, they are almost similar attenuation. But when we apply the twin filtration, we can clearly discriminate between these calcium based stones. Okay, and also dual energy CT with thin filtration can attenuate the lower X-ray energy from the high tube voltage and harden the spectrum. Okay, and of course the important point I would like to highlight here is we can achieve the lower radiation dose, using thin filtration as compared to without thin filtration. Okay? In our study, we found that thin filtration just contribute about 1 milligray of the absorbed dose as compared to without filtration with 1.84 milligray, which is about 54% dose reduction. This is very useful, okay, because when we talk about CT, the radiation dose is a very very hot issue, and uh, we try to achieve in clinical we try to achieve what we call as optimization. Okay, optimization is very important. It's a I mean a lot of study, a lot of effort have been made to achieve optimization. What mean by optimization? We refer to, I mean when we conduct a procedure, okay, we try to achieve with the lowest dose as best as possible, okay, as lowest as possible with the optimum image quality, okay, without I mean with the lowest dose as best as possible without affecting the diagnostic image quality, right? That we call optimization. So you can see that the application of thin filtration in dual energy can is one of the effort, one to be attempted to achieve the CT dose optimization. Okay. And also future work we are planning uh, to validate our result with using the micro CT, okay, to look on the heterogeneous and homogeneous structure of the stone component. Okay, so actually they have a study. I mean, in from they have also the recent study on this microcity, but actually we tried to use our sample at least for the Malaysian sample to look uh, how this the stone, the kidney stone, it can be mapped. The component of the kidney stone can be mapped using micro-CT imaging. Okay, I hope this is the last one. The take-home points. Dual CT is a potential non-destructive tool in preoperative analysis for characterization of renal stone composition, and secondly, dual CT with infiltration is useful for discrimination of non-uric acid stones composition, especially with calcium-based stone. Okay, and also the lastly is the more important is assessment of stone composition is important and has high clinical relevance. Okay, for decision of treatment strategies to optimize the management of patient with kidney stone. Right. Um, okay, I think that's all. That's the reference. Right. Thank you.
Thank you to Mr. Hafizi. Now we open to the participant if any question regarding the topic.
Hi, thank you very much, Hafizi. Thank you for your presentation. Yeah, I have one question regarding your just now. Um, how common is the dual energy CT scan in the hospital? And is it important to differentiate the component of the kidney stone? Yeah, that is my question.
Okay. As far from my knowledge, the application of dual energy is not used as a routine examination. Okay, as far I know, we have one DECT in uh, hospital Tunku Abu Afzal in Kuantan. Okay, that what I presented from my study. Okay, and also for cardiac, if not mistaken, for the cardiac imaging. Okay, they use the dual NTCT, but also it depend on the requirement, which is it's not a routine examination, but it based on the as requested by the clinician to for the further analysis, for the further diagnosis of the disease. Okay, and second one is about the important, right? Actually, as I mentioned in my presentation just now, actually we have uh, in a kidney stone, we have a variety of composition. For example, we have one, we have what we call we have a small stone, for example. Okay, but there are mix of various composition in that stone. Okay, so we can assume that they have. We're not sure is it they have the similar composition or mix of various composition. Okay, so how to differentiate this composition based on the attenuation, based on the concept of attenuation, means that every material they have their own attenuation value based on the density and also the effective number of that material. Okay, so by taking the advantage of microcity, dual energy city, dual energy city can provide spectral separation. You can separate in more precise what call it separation, okay, based on different attenuation value of those material. Okay, that's how uh, the dual energy works. Okay, is it answer your question?
Yeah, right. Thank you,
Yeah,
Hafizi.
yeah.
Yeah, I just want to let everybody know if actually Encik Hafizi is one of the research member in my research group for the Antarctica research grant. That's why my background is dedicated to you, Mr. Hafizi. Yeah, it's the real picture from Antarctic. And also we work together on the micro CT scan for the intrapuparia of the fly of forensic importance to determine the structure. So that was the project that we worked together, just for everybody information. All right, thanks Hafizi for coming to IMMB.
Yeah, any other question? Yes. I'm not sure for those from non-imaging background, is it you understand or not? Actually, I try to make it I try to make it simple and easy to understand the concept of imaging because it's a very technical, right? The imaging is very technical, a very technical discussion. Okay, I try to make those from non-imaging background to understand as well in our discussion this afternoon. Okay, and next question. Okay. Ni Actually, this topic is more relevant to urologists. Okay, urologists because they deal with the stone. Okay, so how the and the point I would like to highlight is what the importance of when we have the ECT, we can make it as a pre-operative assessment. This is very important. Okay, so before we decide to choose or to select which the best treatment should be given to the patient, we can use this dual energeticity data, okay, to identify and to characterize what the component from the uh, from the kidney stones. From that, we can opt for the best treatment for the patient. Okay, because currently, as I mentioned in my presentation just now, most of in practice, they just analyze and they just make chemical analysis, which is FTIR analysis, FTIR spectroscopy, just after the CT, after the CT procedure. Okay, so just make I think less effective. I mean, okay, it's better if we can make much earlier before we plan for the following treatment. Okay, that's how the generally I can say that how the imaging how the imaging modality is helpful in the clinical as a pre assessment. Okay, before we proceed for the further evaluation and further treatment of the particular disease. Okay. Any other question? Please. Can the CT recognize other type of stone? Can still get other type of stone? Okay. So far, from my literature review, so the most common type of stone that have been reported from the literatures uh, as uric acid and non-uric acid, and so under non-uric acid, which is the what called calcium oxalate, calcium phosphate, struvite, brochite, and also hydroxyapatite. Okay, so perhaps we can need further study to identify if there is any other type of stone, other type of component. Okay, from the kidney stone. That's what how the imaging works to make a further evaluation. Okay, at this time currently just and we can identify just a few subtype of stone that I mentioned just now. Okay. Any other question? Yes. Actually, we are very interesting to further analyze with our macrocity. But unfortunately, this since our macrocity is still breaking down, so just pending the analysis. Okay, hopefully on next time we try to take another sample, okay, from of the kidney stone, and to make it as a ex vivo study for the macrocity analysis. We can have another finding how macrocity can characterize and map the various composition of kidney stone.
Yeah.
Okay, right. Yeah.
Other than UiTM Puncak Alam, is there any other places that have micro CT scan?
Yeah, currently macrocity is available in UKM, okay, PP UKM, and also UIA actually. Yeah, UIA Kuantan. As far I know, this three center UiTM, UVM, and also UIA. But unfortunately, our our system is breaking down, so we cannot not much do anything. Okay, so actually a lot of study we can look using the high spatial resolution macrocity, okay, to look on the microstructure of the component. Okay, but hopefully we try to have this our machine can be fixed soon, very soon. Okay, but how about the others? Do you understand from this presentation? I'm quite worried if you cannot get can understand because it's quite technical. Okay.
Yeah, maybe you can ask Alia.
Uh,
Alia is here also.
yeah, okay. Uh,
Do you understand Alia?
Yes, doctor.
uh,
You have
okay,
any
good.
question?
Alia is my ex-student, FYP ex-student. Okay.
No, I don't have.
No question.
Okay. Thank you to Mr. Hafizi.
Okay.
If there is no more questions, so we end our journal club and we continue next week. Thank you to Mr. Hafizi again.
Thank you very much for IMMB, Dr. Hio, for this kind of invitation. Okay, hopefully can
You're welcome.
Yeah.
Our pleasure. Yeah.
Yeah. Okay.
Really nice to meet you. Yeah,
Yeah.
Hafizi. Thanks. Yeah.
Okay. Thank you.
Take care. Have a nice day. Yeah. Thanks for coming, everyone.
So participant can fill in the attendance form in the text message. Again, thank you to all.
Okay. Thank you. Okay. Bye.
All right. Bye, Hafizi. See you again. Yeah.